So first I'd like to show how to use the patient editor. The patient editor is the window with all the patient's vital signs, hemodynamic parameters, cardiac and respiratory profiles. And the device is the cardiac monitor that we have open on the right. So by changing parameters in the patient editor, I can change parameters, hit apply, and then they will propagate over to the cardiac monitor. So if I wanted to simulate a patient whose heart rate is 100, I hit apply, and these changes propagate over to the cardiac monitor. If I want to change blood pressure, or pulse oximetry, or really anything that is currently implemented in Infirmary, I change it, hit apply, and it propagates over to the cardiac monitor. Changing cardiac rhythms has a special option. We have greater than 20 different cardiac rhythms, some lethal, some non-lethal, and we also have the option to use the default vital sign ranges for rhythm changes. With this checkbox checked, if I change this patient out of sinus rhythm and into something like supraventricular tachycardia, it will adjust relevant vital signs to reflect that cardiac rhythm of SVT by increasing the heart rate to 140. Now when I click apply, it will put this patient into SVT at a rate of 140. If I wanted to model SVT at 180, I would just increase the heart rate, hit apply, and now we're at 180. If I want to take them back into a normal sinus rhythm, I just hit sinus rhythm. Apply changes, and the rhythm changed. For non-lethal rhythms, it works that simply. And also for lethal rhythms, you just change the cardiac rhythm, and it will clamp vital signs such as heart rate, but also blood pressure. To reflect a lethal rhythm, it shows lethal blood pressure. By hitting apply changes, all those changes propagate to the device monitor, the cardiac monitor, and you can see this patient is now in VFib. That is how you use the patient parameters window, and next I will show you how to use the device.